Hi, I'm Dr. Daniel Medell, an anesthesiologist, and this is the last video in this series of 12 where I'm answering the most common questions people ask about getting anesthesia. So far we've covered what happens if you wake up during surgery and how rare it is, how anesthesia providers know how much to give you, what anesthesia actually does to your brain, whether or not anesthesia causes memory loss or dementia, why some people wake up confused after surgery, how anesthesia is different for older adults and for kids, and a lot more. So I'll leave a link below to the first video in case you want to watch the whole thing. But after everything we've talked about in this series, there's one last category of fear that never fully goes away and that people love asking about. The super rare worst case anesthesia scenarios. The stories that circulate endlessly online. The events that are terrifying because they're uncommon. Even when people understand how anesthesia works, how carefully it's monitored, and how rare problems are, these fears linger. So in this final video, we're going to talk about the rare anesthesia complications people fear most, what they actually are, and why understanding them calmly is a much better strategy than just pretending they don't exist. So let's get into it. Rare complications carry a special kind of fear. They're completely unfamiliar to most people, they feel uncontrollable, and they're usually described without any context. Unfortunately, the human brain tends to treat rare but dramatic risks as more likely than they really are. But that doesn't mean the fear is irrational, it just means it needs some proportion. Most people aren't afraid of the common things that happen every day. They're afraid of that one story they heard that sounded catastrophic. A single dramatic outcome can outweigh millions of safe anesthetics in the imagination, because your brain is built to remember danger, not statistics. Rare complications also feel especially unsettling because anesthesia involves surrendering control. You're rendered unconscious while someone else is responsible for watching over every vital system in your body. And there's nothing naturally calming about that. When people talk about serious anesthesia complications, they usually mean a small group of possibilities. Severe allergic reactions, unexpected airway problems, dangerous changes in heart rhythm or blood pressure, and very rare genetic reactions to anesthesia medications. Let's not sugarcoat it here. These things do happen, but they're not random lightning strikes. They occur in specific contexts and they're actively anticipated. Like if there's a bunch of stories floating around on Reddit and TikTok about some kind of anesthetic complication, you can be pretty sure it's something that we already know all about. Some of these complications can become life-threatening within minutes if they're not recognized quickly. Airway problems can make it difficult to move oxygen into the lungs. Severe allergic reactions can cause blood pressure to collapse. And certain inherited conditions like malignant hyperthermia can cause the body's metabolism to spiral out of control during anesthesia. These are real events, and they're taken very seriously exactly because when they happen, they can escalate fast. One common misconception is that rare complications are kind of unknown or poorly understood. But it's actually the opposite. Because these complications are serious, they're studied exhaustively. Protocols exist specifically to detect them early. Emergency medications are immediately available in the operating room, and teams rehearse responses over and over long before they're ever needed in real-life situations. Many of the worst anesthetic complications became safer over time because we learned from earlier failures. Modern anesthesia is built on decades of data, reporting systems, and repeated analysis of what went wrong in rare cases. In other words, complications aren't ignored because they're uncommon. They're usually examined more closely than routine outcomes. Entire safety systems exist because anesthesiology assumes that rare events will occasionally happen, and so we prepare for them in advance. Anesthesia safety begins before you even get to the operating room. In the pre-op area, your anesthesia provider will stop by to say hello and ask you a whole bunch of questions about your medical history, what medications you normally take, any relevant family history, and your previous anesthesia experiences. These details matter because they help identify risk before it becomes a problem. Many rare complications are preventable exactly because we know about them. And that's why we ask so many detailed questions that may seem unrelated at first. For example, a family history of unexplained complications during surgery may suggest a genetic condition that changes our anesthetic plans. A history of severe acid reflux may influence airway management, and certain medications can interact with anesthesia in ways that increase bleeding risk blood pressure instability, or delayed recovery. These conversations may feel routine, but they're often where hidden risk is discovered before the surgery even begins. No medical specialty pretends that risk is zero. What matters most is how that risk is managed. If something unexpected happens during anesthesia, it happens in a setting where the patient is already being monitored closely. We can see oxygen and carbon dioxide levels, heart rhythm, pulse rate, blood pressure, breathing rate, body temperature, and a bunch of other stuff in real time. That way, problems can be detected as early as possible. And early detection is what turns rare catastrophes into manageable events. This is one of the major differences between a medical emergency happening unexpectedly in daily life versus inside an operating room. In the OR, the patient is already connected to monitors. IV access is already in place. Oxygen and emergency medications are immediately available, and trained doctors and nurses are standing right there the whole time watching over everything. Of course, that doesn't make complications impossible, but it does drastically shorten the time between problem and response. In anesthesia, seconds matter, and the environment is designed around catching problems before they become irreversible. So what's the bottom line then? Well, serious anesthesia complications exist, but they're rare, they're anticipated, and they're managed in real time by teams whose focus is patient safety. Of course, understanding that doesn't eliminate fear entirely, but it can definitely help replace some of that vague dread with realistic context. And that's the difference between fear and informed expectations. No honest anesthesiologist would say that anesthesia is risk-free. Every medical intervention carries some degree of uncertainty. But the important truth is that anesthesia is not dangerous because risks are hidden. It's safer than ever because risks are known, studied, monitored, and actively prepared for. Remember, if you're about to have surgery, or someone you care about is, it's completely normal to feel anxious. Anesthesia involves surrendering control, and that's uncomfortable for almost everyone, including most anesthesiologists. But through this series of videos, we've walked through what anesthesia is and how it works, what awareness really is, how rare it is, how anesthesia is monitored and adjusted, what it does to the brain, why recovery can sometimes look strange, how age changes care, and why serious complications are uncommon but planned for. If you'd like to understand what the experience of going under anesthesia actually feels like from start to finish, that's where this series began. The first video kind of ties everything together, so I'll leave a link to it below. Thank you so much for watching. I really like making these videos, and it kind of makes me feel good when people watch them, so I'm really grateful to everyone who's stuck with me throughout this entire series. Thank you, and may we never meet in the operating room. But I will see you in the next video.